I'm Mogens Horte. Welcome to this webinar. My research focus over the latest decade has been on patient and public involvement nationally and internationally. And I invite you to join me on a journey on how I have experienced the implementation of patient and public involvement in research in Denmark over this last decade. Now, the topics of my presentation will be, as you see on the screen, first a little about what is Denmark, when PPI first appeared on the stage around 2009. Now, how we learned about the implementation of PPI around 2016 by mapping, and how we have experienced tools to improve the implementation, what we learned, what worked, what didn't work, and how to get the researchers on board, which is a crucial part of PPI to be a success, and then where to go next. Now, this is Denmark on the map, a small country, population 5 to 6 million, 5.6 million. Now, our civil society is very strong, and we have a lot of voluntary associations. There are plenty. And I mention this because this may be also a background for the willingness of people to join healthcare as part in research, not only about us, but also to be part of research, which is one of the observations we have made over the years. Now, the healthcare sector is public, it's financed by taxes. Now, the research level is high ranking by these different measurements you can make based on the number of inhabitants. We are among the top 5 in the world. So this was the scene. Then now, talking about patient and public involvement in research, you must have a way of systemize this. And this is the way we have systemized when we are looking at what the situation is. To your right, you will see how patient and public involvement is part of making research strategies, making prioritizations, et cetera. And around the research strategy or the research funding board, et cetera, you see managers, you see researchers, you may see patients. Now, to the left, you see the PPI at the project level, where you have patients and researchers around the research project. Now, to the right is the top-down approach, and to the left is the bottom-up approach. And I will return to this bottom-up, top-down balance during my talk. The first stop I want to make is back around 2010, 2012. The Ministry of Health had established a National Forum for Health Research, and on the agenda came patient and public involvement. A group was established that should look at this and come up with a recommendation for this National Forum. I was asked to chair this group, and the group consisted of researchers, managers, and also representatives from patient organizations. Now, we decided to make a study tour to England, and we were very warmly welcomed by Involve and had a wonderful 3 days tour through the research environments where PPI was blooming, and had a lot of experience when we come home. But we were at the starting point and not at the level that was in England. So we had another situation. So what we had to do also was that we looked then in 2016, the Minister of Health decided that it was time to look at what is the situation. And that was part of a national knowledge sharing project on patient involvement in general, not only in research, but in general. But I was asked to chair a project called the Patient as Partner in Danish Health Research. And we did that. I did that from my University of Southern Denmark, together with the knowledge center for patients involvement, user involvement in Denmark, called VIBIS. You see the logo down in the left side. It's an umbrella organization for all patient organizations in Denmark, and has a lot of network all over to patient organizations in Denmark. Now, what we were asked to do was to make a mapping of the current PPI activities in health research. We should also initiate how we could share experiences about implementation. We should contribute or find out how we could, or recommend how to contribute to the training of researchers, and also how to establish PPI networks among research centers in Denmark. So this was the agenda for this project. The mapping, you see here the outcome of the mapping. Not the outcome, but the pattern of the mapping. What we did, we didn't want to make questionnaires. We want to make physical meetings. So what we did, we invited ourselves to visit health care research, that is healthcare at universities, healthcare at university hospital, and healthcare research at regional hospital. We also visited psychiatry institution, general practice, and also a few research foundations. So on the map, you just see how we traveled through Denmark and had a lot of visits and a lot of knowledge that we brought back. So the outcome of the mapping, first to the top down, the strategy, and this was what we mostly asked for. We made this visit, and we met management and also research boards. So the questions that we raised for the discussion with these boards and managers were: now, does this research institution have a strategy for PPI written down, or we have discussions on it? Now, which roles do patients have in implementing PPI? Are there patients as member of research boards, et cetera, et cetera? And do you know about projects at your institution where PPI has been applied? These were the questions, and of course, these were the starting questions, but during these physical meetings, we had a dialogue. The meetings lasted between 1 hour up to 2 hours. So we had discussions that also was kind of implementation, because there was, of course, interest from the sides of these managers and so on to learn about this, because some of them had never heard about this. Others were considering how to get started. So this was about giving advice, et cetera, et cetera. And not two meetings had the same course, and the same topics were not discussed at all the meetings. It was very diverse. Now, the results or the outcome that we got was at faculties of health at the universities. We have 4 universities, and nil of these faculties had considered to have a strategy for patient and public involvement in research. When we came to the university hospitals, we have 6 of those, and 2 of the university hospitals, PPI was on the agenda. On one university hospital, written strategy and very active. On another, starting up and have some experiences. Now, at the regional hospitals, we visited 14, 15 regional hospitals, and 3 of those had a full-blown PPI strategy and were using it for a lot of the research there, and 2 others was on their way. The roles of the patients in these strategies and so on was they were invited as member of research boards and so on to discuss the research strategy of the institution, to prioritize research application, and also being a part of the activities for dissemination of research strategy at meetings, etc., etc. Now, we also learned that at some of the, and that it was in fact both at one university hospital, at one regional hospital. Now the management, they considered participation in research as part of the more wide topic of engaging patients and citizens in healthcare. They didn't distinguish between patient engagement in research and patient engagement in healthcare. Now, and I want to point to this because this is a way of understanding how you look at it from the side of the hospital. And it's my experience so far that you could look at these patient-centered healthcare activities that started in Denmark around 2014, which is patient-reported outcome, PRO or PROM, as you know it. When this is introduced at a hospital, or shared decision-making in healthcare, this goes hand in hand with patient and public involvement in research. It's a kind of broad strategy of the institution, which also means that it's not only researchers and patients that are involved, it's also the healthcare professionals, because they will all be involved in this about PROM or shared decision making. So I think you can consider an overall strategy for patient-centered healthcare as a booster for implementation of PPI.